Okay, this is a voice recording for the skeleton unit. We'll go through the axial skeleton first, and then we'll go through the appendicular. I try to help you out as far as identifying major features and ways that you can figure out proximal and distal and some of the components of orientations of the bones. So let's start off here with the lateral view of the skull. There's a lot of bones in the axial skeleton that you have to know. There's approximately 80 in the axial skeleton, so 80 in the axial. And there is 126 in the appendicular, making up your making up your 206 that make up your body, bones in your body. So let's start. I'm just going to kind of hit a couple different ones as we go through. So this first one right here on the bridge of your nose is the nasal. Those are the nasal bones. Next one right here is the frontal. Right, you can kind of see how the frontal makes up not only the top of your eyebrow ridge, but it also goes inside your eye socket here, so that's frontal bone. And this tiny little one right here on the inside of the eye, right where your tear ducts are, that's the lacrimal. Now, anytime we see a divot in a bone, like this divot right here, that's a fossa. So this is the lacrimal fossa, F-O-S-S-A. So that's the lacrimal fossa. And then we have this part of the face, so the top part of the jaw, that's your maxilla. And then the bottom of the jaw is the mandible. Now, anytime you run across these holes where the nutrients kind of feed through, call those foramen. So there's three ones, and I'm going to draw one up here too. There's three that you have to know on the front of the face, and then for our test purposes, we have a couple on the underside, which I'll get to in a little bit. So there's the supraorbital foramen, because orbital means the eye socket or the circle, so supra means above, so supraorbital foramen. There's the infra, which means below orbital foramen, that's this one. And then there's this one right here, which is the mental foramen in the mandible. Okay, this green bone, moving on, is the zygomatic bone. And then the purple bone is the sphenoid bone. Right? Now, you'll see later that sphenoid is a complex one. It does the inside of the eye socket. Now this lightish purple blue one is the ethmoid bone. I'm going to try to fit all these words on here, but if not, follow your guide as you're reviewing, watching this video. And then, oh, I didn't write sphenoid, sorry. So sphenoid. And then this right here, this zygomatic bone, and then it kind of makes a bridge right here. This will make the zygomatic process, or the zygomatic arch. But notice that this is the same color as this, so that means that it's made out of the same bone, and that bone is the temporal bone. You actually see there's a lot of things that we have to know in the temporal bone, like this hole right here, that is right where your ear would be, and that's where sound is coming in. So this is the auditory meatus, or the external auditory meatus. So that's a hole that'll go into your side of your head that allows the sound to transmit and then receive through the brain. You have this bump down here, which is the mastoid process. And then you have this spike down here, which is the styloid process. So the mastoid process is going to allow for the masseter, which is a muscle that helps with chewing. And then the tongue is going to actually come in and attach to this process right there. Last bone, or two last bones on this side view. One is the occipital right here. And then this blue one is the parietal. As far as our test is concerned, we're going to talk about the four major sutures. There's a lot of different sutures, but we're going to focus on the four main ones. So the one that divides the frontal from the parietal right across here is the coronal suture. You have to know this one that divides the parietal from the temporal. That's a squamous suture. And then you have to know the one that divides the parietal from the occipital, which is the lambdoidal suture. The one that you cannot see, which goes down the center here and divides the parietals, would be the sagittal suture that goes across the top. And we'll see that possibly in another picture. Right? So there's the side view. Continue on. Do the frontal view here. Select and move this. Okay. So head-on shot here. We'll run through some of the major ones that are on this one. So right off the bat in the front here, bone that we haven't talked about yet, this one right here, that's the vomer, making up the inferior nasal concha area. And then this new one, which we could kind of see in the last one, but you see it a lot better here, the ethmoid bone. And the ethmoid starts kind of on the inside of the eye socket here, and then it traces its way down here. And the way that I always like to remember it, students often mess up this one over here, the sphenoid that comes off the side of your head, and the ethmoid a lot of times, but the ethmoid makes this M shape, ethmoid. Okay? On the bridge of your nose, once again, is the nasal bones. And then we have the zygomatic bone that comes off along the side here. It makes up parts of your cheek. You can kind of see the sutures here. The maxilla, very easy to see here, making up the lower parts of the jaw. You see that infraorbital foramen and the supraorbital foramen up here. This is the glabella of the frontal bone. Right, so that's a frontal bone there. And you can, like I said, kind of see some of the other pieces of some of the other bones. The mandible, lower one here, and you can see the mental foramen on the bottom half of this mandible. And that gets you through the frontal view. The inferior view now, let's look at some of the major things that you have to know for this one. And I think the ones that students goof up the most are the different foramen that are on this one. So let's kind of talk through some of those ones. Okay, so let's continue on with the different foramen that you need to know. So we have the foramen ovale, the foramen lacerum, okay? And then the carotid foramen and the jugular foramen. Okay, so ovale, spell it wrong, ovale, and lacerum, and then the carotid, and the jugular. Okay, and then this big, huge, gigantic one you definitely have to know. That's the foramen magnum. Okay, and the only other one that here you can see the vomer coming up through the bottom of the nose. Right, we can see the palatine finally here, right, which makes up the hard palate. Part of the hard palate. The other hard palate one is the maxilla, right? So you're seeing the maxilla on the underside here, right? The sphenoid, and then you've got the temporal here, right? And you can kind of see the frontal bone, sorry, right here. A little bit of parietal over here, and definitely a lot of occipital, right, making up the back half of the head here. But the big one that will show up on the lab practical are these foramen that are on the underside. So you definitely have to know these 5 foramen. There are others, but we're going to focus on these 5 foramen. You can see that styloid process here and the mastoid process again on the underside as well. Okay, so that's the inferior view. All right, let's move on to advance. Let's get on to the spine here, and let's talk about some of the ways that you can identify the different vertebrae and memorizing the numbers of vertebrae for each section. So cervical is first, and the way that you can kind of remember it is it all goes with the meals, trying to figure out how many there are. So we tend to wake up in the morning and we have breakfast at 7 a.m. So there's 7 cervical vertebrae. You have to know the first two for sure, the atlas, which holds the most important thing, kind of like the Greek titans holding the globe. The atlas holds your head, right, and allows for the movement of no, right, moving your chin up and then moving your chin down. The axis is the next one. The easiest way to identify the axis is you have this protrusion off the top of it that is kind of like the atlas for the Earth. It allows it to rotate around the Earth, so that will allow for the yes-no motion of your head. Okay, so the atlas and the axis. Okay, then we move down and we have lunch, right, around noon. And noon, there's 12 vertebrae, so those are the thoracic vertebrae. And you should know the transverse process right here area, not the spinous process, but the transverse process is going to be where the ribs connect to. They come around to the front and allow for attaching to the sternum. Okay, the sternum has those three parts: the manubrium, which is the top piece, the body, and then the xiphoid process. Know that the first 7 ribs that connect to the sternum are the true ribs, and then you have the last 5, which are false ribs. But the last 2 of those 5 are false ribs that are floating ribs because they don't have any cartilage that connect up to the sternum. All right, so that's the thoracic, and the thoracic have that shape that makes it look like a giraffe. Right, so you end up getting this type of shape to the thoracics, and then we finish out and we have dinner around 5 p.m. So that's the lumbar vertebrae, and we get kind of more of a moose shape for the lumbar vertebrae, right? And then we have the sacrum, which is 5 fused vertebrae. We have the sacrum, right? And then depending on the individual, you might have 4 to 5 vertebrae that are kind of fused together in the coccyx. Okay, so that's the spine. That completes our axial skeleton once. We should move on to the different parts of the appendicular. So the first thing here is the clavicle. You have to identify the clavicle, so it's this very S-shaped bone. Okay, one side is almost like it's pinched together, and the other side is much more bulbous. This is the area that's in the medial side of your body, so this is going to be attaching closer to your sternum, and so that's why it says sternal end here. The top half is smoother, and the bottom half has many more ridges to the bottom half, and the pinched end, or the lateral side, is going to be the ones that connect up with your clavicle. So here's the clavicle, and the clavicle, oops, tool. The clavicle identification from right to left, the easiest way that I can help you out with identifying the clavicle is find the curvature. All right, so it curves concave with your back, so it's not going to bend towards your front, it's going to bend towards your dorsal. And once you find that, then you can find the glenoid cavity, like it says here, which is where the humerus kind of connects in. Right, so the head of the humerus will be there. So once you find this piece, then we can see, you know, this triangle shape. The triangle, this point of the triangle points towards your humerus. So once you figure out which way it's bending, you can figure out which way the humerus is going, and you can then find out the right versus the left. Remember that patient perspective is all what it's about. So this one right here would be a right clavicle based on how I was explaining it. And here you can see the back half. So it's curving more like this. This one, like I said, curving this way. So we're definitely seeing the right clavicle in this picture. Or right, yeah, right clavicle. All right. So the next thing here is your humerus. And the humerus is, the easiest way to identify the humerus is first find the bulb end. Okay, so this bulb end is what's going to go into the socket, so your ball and socket. We should make a mention of a tubercle or a tuberosity. These are areas, projections where muscles are going to attach on your test. Remember, fossa are divots. And then we have condyles as well, which are kind of smooth surface edges. Remember that I had said that once you find the bow tie, so here's the bow tie of the humerus, this is going to be on the inside of your hinge joint. You can see the divot here, and this is where the ulna, the back of the ulna, is going to groove into. But this bow tie is going to be the inside of your hinge. So if we were to draw a hinge, right, and it lays out completely like this, the bow tie would be in the hinge. This goes both for your arms and your legs. So that bow tie is this side right here. This has to go into the joint. So based on that, this would also be a right humerus. Okay. You notice the back looks a little different. We don't see that bow tie on the back side. Okay. Next one here is the ulna. The way that I know, well, this one is the radius. But here we see the ulna. The ulna has this C-shaped or U-shaped on the proximal end, and on the distal end, it's a much thinner head on the distal end. The radius, conversely, is narrower on the proximal end and thicker on the distal end. And remember, the ulna identification is the U, and then the radius, we have this pedestal piece that has a three-dimensional kind of divot that is allowing the radius to do exactly what it's named after, allow for it to kind of circle your thumb around. And on that distal side there, here we have this piece. On the back side of the radius, there's these ridged bumps. They're very, so if I'm drawing the topographical surface of the radius, you're going to see these bumps. This will be on the dorsal side or the back side of your hand. This side is much smoother. How do we figure out a right radius versus a left radius, or a right ulna versus a left ulna? The radius is always going to be on your thumb side. So remember that correct anatomical position, the person's standing like this, right? Their thumbs pointed outward. So I'm going to try to give you my best rendering of a cartoon. So there's his thumb outside. So the radius is going to be on this side, and the ulna is going to be more medial, radius lateral. So then to figure out if this is a right or a left, the ulna will have a sharp edge to it. The sharp edge always points to the sharp edge of the radius. So when we're lining all these pieces up, you can figure out which side is the sharp side. Know that the ulna has to be on the inside of the arm, and so in this case right here, this would not be his right arm, this would be his left arm, based on the way that this is all drawn out, because this would have to be his thumb over here, right, and this would be the pinky side, because PU, pinky, to ulna, is your orientation for that piece. And we'll see the same trend of sharp edge on the inside facing a sharp edge, and that's going to allow for connective tissue to hold those two bones together. We need those sharp edges, not smooth edges. All right. Next, we have the pelvis, or the pelvic girdle area. Once again, we see the sacrum right here, which is still part of the axial skeleton, and the coccygeal, which is the part of the axial skeleton. So the pelvis is actually the piece of the appendicular, and there's three parts of the pelvis that you have to know: the ilium, the ischium, and the pubis. Notes the socket right here, and this is where the femur is going to connect into. And then you'll see some rough grooves of where the sacrum attaches to each side. Remember that pubis has to face forward, ilium has to be at the top. That'll help you with orientation to figure out right side versus left side. Next up, femur, right? So we have the socket, once again, that needs to go into the ball and socket joint. So that's the first thing you look for in identification, and then look for that bow tie, right? So here we see the bow tie. Okay, remember the bow tie has to go inside the hinge, right? And since the leg bends backwards, right? So if this is your foot, it's got to bend up towards your butt, right? So the hinge is here, so the bow tie's got to be on the back side. So in this case right here, we see this going into the socket here, the bow tie on the back side. So this is actually a right leg in this scenario, okay? Okay, lower part of the leg now. So we have the tibia and the fibula. Fibula being the much thinner piece, tibia being the much thicker piece. So up here at the top, you see the condyles. This is going to attach to the femur. And then the lower pieces of the tibia, you can see there's this extra little notch right here. This notch is going to be your inside ankle bone, and this piece right here of the fibula will be your outside ankle bone. So if we draw out the foot, here's your toes, But there's your big toes, little toes. So this will be the inside bone. This will be the outside bone. So always know that the tibia makes up your shin bone, big, huge piece. And then the very farther or distal piece of the tibia is going to make up that inside one. So that way you can figure out right versus left easier. So how do we figure out fibula? Because it's just this thin bone. Well, the one end of the fibula, when you hold it, is going to make more of a butter knife. Oh, that's not a butter knife. More of a butter knife type of shape to it, whereas the other piece is going to be kind of more flat and blob-like, right? So the fibula. And then, like I said, with the radius and the ulna, we have a sharper edge of the fibula and then a sharper edge of the tibia, and they have to point towards each other so that we can have some connective tissue holding those two bones together nicely. So once you find out tibia, right, which way the tibia is going, that ankle piece has to be on the inside. So this has to be a person's right leg that you're looking at right now. Okay? So proximal end thicker, distal end thinner. Here we have proximal end kind of blob-like and distal end more butter knife-like. And then find those edges, those sharp edges on those bones when you pick them up to figure out which way is medial and which one's lateral. Okay? So that's your lower leg. All right, last piece is looking at the different parts of the foot. It's always going to go tarsals, metatarsals, phalanges, and the phalanges are always going to be your toes, are always going to be your fingers. So the tarsals and the metatarsals make up the major part of your foot. So the arch of your foot is mostly metatarsals and some lower pieces of tarsals. The ones that you definitely have to know. On the test, you definitely have to know the calcaneus, which is your heel, big, huge one. The talus, which incorporates or works into your tibia. Right, so you can see that notch there, that's where the talus is. Right underneath that talus is the navicular, right? And then on the outside of the foot, or the distal, or the lateral, I should say, part of the foot is the cuboid. And then we have these couple cuneiform bones before we get out to the metatarsal. So, like I said, on the test, this will all be extra credit if you're working on trying to identify some of the foot bones. Same thing goes with the hand bones. Move on to the hand bones here. These are extra credit on the test as well. So here you're looking palm up. We're looking at the bones. So here's the radius and here's the ulna. Notice that you don't see those ridges here because the palm is up. If it was the hand was turned over and you're looking at the radius, you'd see like some extra ridges on that. But radius and ulna, thumb side here, right? So here we have the radius, thumb side. You should just know them in order, try to memorize them. The easiest one to kind of identify when you're looking at the hand is the pisiform because it's this little ball that sits on top of the triquetrum. And then we go lunate, scaphoid, trapezium, trapezoid, capitate, hamate, and we're back around again, right? So you just have to try to figure out a way to memorize them as you're going through all the different bones of the carpals, okay? And then it goes metacarpals, which make up the palm of your hand, and then phalanges, which will make up your fingers, all right? That is the whole recording for the axial and appendicular skeleton. I hope this helps a little bit. If not, come on in for some extra help before we sit down and take that test. Wish you the best of luck.